First, before we do the unit care, I'd like to go over some of the items that we'll be looking at as far as protective equipment and some of the barriers that we'll be using. On the left side of the unit, you'll see here on the counter I have a mask and my over glasses or utility glasses. These are to be worn when we're donning and doping our PPE for unit care. If I move this way, I also have for dental sealants the Smart Light. And the Smart Light is to remain in the unit, and this would be looked after in the unit during unit care at the end for pre-cleaning and disinfecting. The paddle that you see here, which goes along with the Smart Light for curing a dental sealant, this would be pre-cleaned and disinfected in the sterilization area. So when we're ready to clean up, the paddle would go on top of this kit that has barriers inside to place on the light cure. So at the end of the procedure, the paddle would just be placed on top and taken to sterilization area. During the procedure, the paddle will remain on the counter as such. The barrier for the Smart Light fits right over the Smart Light, which is located in the kit, and fits over the Smart Light completely. When the Smart Light is completely charged, it can be left on the counter as so, and the charger can be placed inside the kit to the side, just to keep it safe from any aerosols, if there are any. And then to the side. Next, we have over gloves. And over gloves, when we talk about our PPE, over gloves are utilized when we are going inside a kit to retrieve any items that you may have forgotten to place out on the counter, or as if in impressions, you may utilize your over gloves to touch any items that are on the clean side of the counter to measure and distribute. We have here our procedure gloves. And again, I'll talk to you about where we receive our procedure gloves and our PPE for unit care shortly. And then we have utility gloves. Now, utility gloves are generally here at our clinic used in the sterilization area. We don't need to use the utility gloves during unit care, but you could. In fact, you may see your textbook mention to use utility gloves. But we're going to use our procedure gloves, which are nitrile. Nitrile can be used in place of the utility gloves in unit care when you're pre-cleaning and disinfecting. When handling instruments in the sterilization area, you must utilize the utility gloves because they are manufactured to repel any puncture of sharp instruments. The utility gloves, when we are storing our utility gloves, just to mention this, to remind everybody, they're pre-cleaned and disinfected, and then they're kept inside a baggie and sealed for use for next time in the sterilization area. Then over here we have a mirror that's utilized for some of the tray setups for unit care. Polishing and fluoride is one setup, and the other is the dental sealants. You'll be utilizing the hand mirror for the patient to look at themselves during the procedure or for patient education. The mirror, when we're finding where it's located, and if you follow my hand here, on the bottom right hand side of this counter unit, you have a cupboard that is for personal storage or for the mirror storage, and it would be stored right here in this basket. Once it's pre-cleaned and disinfected, it goes away in there. And then of course on the left hand side, we would have your items that are located in the cupboard here that are your barriers. So when we're going to be performing the unit care procedure, you walk into your unit, you're going to visually, from a distance, inspect what areas that may appear to be dusty or may have some dirt left on the ground from the previous day, or even the previous, if there was any procedure done in that unit. So take a good look around. Look at areas such as your countertops, the tops here on your divider wall. Take a look at the light on your chair. Take a look under the patient chair, and etc. That way you're just doing a quick visual to see what I need to pre-clean. And just to remind you, pre-cleaning is removing any dirt or debris or dust. The second time when we're disinfecting is to disinfect our surfaces. So pre-cleaning is very important at the beginning when you're walking into your unit to really take a note of what needs to be pre-cleaned. So once we've taken note, we're going to then do our PPE. Now I have my PPE on, my safety glasses and my mask and my gloves. And of course, your PPE is located on the north wall, adjacent from your dental unit. We're going to take a look at a few things of our dental unit before I start pre-cleaning. So the dental cart is the first thing that we're going to look at, and you can pull the dental cart out, and underneath you have your switches for turning on your dental cart, and at the side is the water bottle. We're checking to see how much water we have inside the water bottle because we need to purge the water lines for 2 minutes before patient care and at the end of patient care. Also, by pulling the cart out, you want to remove your rheostat and place it on the ground because that would be pre-cleaned also during the pre-cleaning procedure for unit care, but it does not need to be disinfected because we use our foot on the rheostat. It's going to get dirty anyway with the feet, so we pre-clean it. So once we've done that, I would have filled up my water bottle, which is located at the water tower, and I would have removed my water bottle very carefully without touching the blue line and refilling with 1 squirt of E2O, coming back and turning on my unit, and you'll hear it turn on. It's pressurizing, and now it is ready to purge. So when we pick up the 3-way syringe, we don't put a tip on it to purge it. We want to purge it without a tip. because we're trying to get rid of any of the biofilm that has been collecting in the line. So we're just going to stick our foot on the rheostat and run a line that also you may be utilizing if you're using a line for water, which is here. It's black. You can see here. There's a water line here. You would use your rheostat to run your water line if you were using it, but we're not using this for any of our procedures. We're only going to run our three-way syringe where we just put our finger on the water button. And you can see here it runs directly out of the three-way syringe opening. And we run that for 2 minutes. Now that we have refilled our water, I have turned on my power switch to my unit. Now I'm ready to pre-clean the unit, and that's removing any dust or debris that may be present. So before I do that, I'm going to go to my swipes, which is my disinfecting swipes. It's a 1-minute disinfectant, tuberculin level. And before I start wiping anything, take one and just wipe your gloves. And discard that. And you've got another wipe and you're ready to pre-clean. So I'm just going to wipe everything down once. So you're going to go over all your areas that may be dusty when you're pre-cleaning, all your countertops, and the list that's provided. Once we've pre-cleaned all of the areas, then you're going to disinfect everything that is listed except the rheostat. Now that I have pre-cleaned and disinfected all of the areas that were listed, now I'm going to remove my gloves and sanitize my hands and prepare for placing my barriers. So to do that, that's our PPE removal. So I would have removed my PPE and my mask, and now I'm ready to place my barriers. So I'm sanitizing my hands one time, or you can wash your hands one time 15 seconds. So to place your barriers in the cupboard, there is your sticky barriers that you're going to have to pull out, your bib, your tray paper, and your barrier tubes. Now I've placed all of my barriers. I have my barriers on the areas that were mentioned to place barriers. And on any switches, any areas that you're going to be touching all the time, you want to place your barriers. I also have retrieved out of my cupboard the 2 barriers that I require for this procedure. My bib, patient bib. I have the tray paper, and after I had placed my barriers and everything was out that I needed, I retrieved my instruments from dispensary. Okay. Now I'm ready to open my packages and set up for the procedure. So when we're opening our bagged items, our sterilized packaged items that you retrieve from dispensary, all you have to do is grab the paper side and the plastic side and open and place on your countertop. So now that I have some of my items out of my metal kit that I required for this procedure, which is polish and fluoride, I have my basic 3 that is set up, and this came from my metal kit, along with some other items that I've retrieved also from my plastic kit. And I'll show you where my plastic kit is to be placed when we're in storage during a procedure. Here we have a bib that is placed, and I have some other items that I removed from the plastic kit, which is in storage, which I'll show you shortly. So I have my 3-way syringe tip, which I'm going to place for you so you can see how it looks when it is placed in the 3-way syringe holder. Click back on the ring, place your tip, and it will click back out, and just pull on it to make sure it's engaged. Once you have your tip on there, you can grab your tube sleeve, and at the end of your tube sleeve, you'll know that there's a hole here for the syringe tip to go through. So you can't place your barrier tube sleeves on until you've actually placed the tips. So you're just going to continue through like so, and I like to bunch it up at the top. It makes it easier to pull down. And the next one I have on here, which came from the metal kit, is your high volume section, which is placed on the high volume, which is at the end here. And you're going to require to place a tube sleeve on there also. We're going to use the same type of tube sleeve. So again, place this by bunching it at the top. Make sure it's off or it will suck in the plastic. And then once you get it bunched to where you want it, just pull it over the tubing. Next, you have a saliva ejector, which is placed in the saliva ejector tube holder, and tube sleeve also goes over that once you get the saliva ejector tip in there. And again, bunch it up at the top till you get the tip through, and then pull it down, and then place in its holder. For the handpiece, we do not place a tube sleeve because it would be dangerous. The tube sleeve, you'll notice here, is loose from the items that it's placed on. So you cannot have a tube sleeve on your handpiece because we need to have a direct grip to the handpiece. The handpieces are oiled and cleaned in sterilization area and then sterilized at the end. So there's no purpose of placing a tube sleeve on here. We do have, however, our tips that are placed in our handpiece. In this case, we have here our handpiece, which is the Midwest handpiece, and these fit right on top. They just pop right into the Midwest. I also have the items that I removed from the plastic kit, which is located over here, just above your sink on the clean side. So we've basically separated our dirty side, which is our working side, to our clean side, which is where you're going to store your items that you've placed for use from your sundries kit that is stored here far enough away from any aerosols. Also, I have on top of this kit some overgloves in case you need to go back inside this kit if you've forgotten anything. I also placed on the counter just above, out of way, is your mirror that you require for patient care, for education, and for the patient to look at themselves just above out of the way so that it doesn't become contaminated by the aerosol. It's just up out of the way. And that way you can just grab it here. Now that everything is set up, you can take your patient bib, just place it over your items so that your patient cannot see them when they walk into the unit. Also, you want to make sure that everything is working. So at this point, check to see is your unit on, for example, and it should be on. Once it's on, check to make sure that your handpiece is working. And after you've done that, now you're ready to wash your hands 1 times 15 seconds. Now that the patient has been escorted to the reception area and the unit now has been utilized for patient care, we're going to now take everything down and pre-clean and disinfect the areas. So what you want to do is when you come into the unit, we're going to perform our hand washing, which is 1 times 15 seconds, and placing our PPE. Now that I've placed my PPE, I'm ready to remove all the barriers. So if you recall, the sticky barriers are on all of the areas that we touch all the time and to cover up any switches that disinfectant may get into. So when you're removing the barriers, such as on the light, you want to gather your barrier as best you can. And then on your switches, you're going to gather all your barriers. Your barriers that are located on your assisting chair and your operating chair. Once I've removed my barriers on the switches, the light, and the assisting chair and the operating chair, I'm going to come back to the operating unit, our mobile cart. So what we're going to do is remove any items that are located here in your Midwest RDH handpiece. Remove the handpiece. Then we're going to remove our 3-way syringe tip. So again, just as we put it on, there's a little ring that we press our finger on, and we're just going to pop out the syringe tip and remove the tube barrier. And you want to remove it so you're not touching the tubing as much. And that's discarded. Next is our saliva ejector. And sometimes they get twisted up, and that's okay. This would be a time just to untwist it. And to remove it, hang on here, there we are. And to remove it, just grab the tip here, pull this up a little bit, hold it more towards the top, and just let the tube sleeve slip off without dropping it on the floor, and then place back. That way we haven't touched the tubing. And then discard. Then our high volume, pull up the tubing, and pull off the high volume, and it just sits here on the counter ready to be placed away in the metal kit. And I'm going to talk to you about what we put back in the metal kit that's sitting here. So whatever you took from the metal kit is going to go back in the metal kit. Whatever you took from the plastic sundries, which is on your clean side, you never put anything back in there. Okay? That is like a drawer. Treat it like a drawer. We're going to go in the drawer with overgloves on, but we never put anything back in the sundries kit that has been utilized for patient care. So I have my items here on my tray paper. The patient's gone, of course. And I'm just going to put back in the metal kit what goes back in the metal kit. And here the 3-way syringe tip has a little clip that it fits into. You never want to place the 3-way syringe tip loosely in your metal kit because it will fall out and then we'll end up losing it. So this little clip, that is in our kit is there for a purpose. Okay. Other items that you see here that are disposable, they are disposable, so you can actually dispose of your items that are disposable. Close your kit carefully. The handpiece is left out. It never goes inside a metal kit because it came separate. It goes back to sterilization area separate. We're going to grab our plastic kit here, put our handpiece back on top. Now that I've removed all of the barriers and off of the everywhere, off of the mobile cart, off of our chairs, I've discarded any disposables. I'm ready now to take my items to sterilization area. Something to mention about when you're carrying your kit and items back to sterilization area for processing, never touch your uniform. You want to carry it away from your uniform. Came back from sterilization area, passed my kits to the people that were working in sterilization area, and I was asked, is anything contaminated? No, nothing was contaminated. And what they're referring to are the items that are inside the plastic sundries kit. And then I received my gobble. My gobble is what I'm going to use to clean the suction tubing. So in this procedure, and not all procedures use the saliva ejector and high volume suction at the same time, but I used for polishing and fluoride, as an example, the saliva ejector and my high volume. I am going to take my saliva ejector, turn it on, and place it in the gobble until it's all gone. The other one, same thing for the high volume. There we are. And this will help keep our suction tubes free of debris and will give it a nice clean between patients. Now, gobble can be utilized in dental practices, and you've probably seen this on the actual gobble container used at the end of the day. But since we are utilizing our units frequently, we're going to actually use it on our suctions in between patients rather than at the end of the day. So once we've utilized the gobble, now I'm going to disinfect my gloves. So I'm going to grab one wipe and just wipe my gloves once. And now I'm going to grab another wipe and I'm going to start pre-cleaning my unit. So how by doing that, I'm going to pre-clean the areas that were utilized during patient care. So you're going to wipe once your countertops and all the areas listed, including your tubing. I wanted to make sure I show this to you when we're pre-cleaning and disinfecting our tubing, that we not only get the item that was touched with the barrier, but we give the tubing a good wipe. And then you come to our mirror, which was utilized for patient care. Just give the mirror a good wipe down for pre-cleaning. Leave it on the counter and continue on and pre-clean once and then disinfect. When we're ready to disinfect, just as your steps say so, when we've pre-cleaned everything, you're going to then, for disinfecting, wipe our gloves and then wipe everything the second time. So I've pre-cleaned and then disinfected all of the areas that are listed. I'm going to place away in the cupboard the mirror for storage. And as you recall, the right-hand side cupboard is for personal items and, of course, storage of the mirror. So once we've completed our unit care, we've pre-cleaned and then disinfected everything. We've taken our instruments before we pre-cleaned and disinfected to unit sterilization area, used our gobble to help to clean our lines. And at the very end, we also want to purge our water line once more for 2 minutes. And then once I've purged my water line for 2 minutes, turn your unit off. You'll hear it. Then we're ready to take our garbage to the sterilization area. So when you remove the garbage from the garbage can, there will be a clean one underneath. And if you do run out of garbage bags, or you notice there aren't any in there in the bottom, they're kept in the storage cupboard, which I've provided a picture of. I've taken the garbage to the sterilization area. Now I'm going to place the clean bag in. And then now we're ready to remove our PPE.